I'm Deborah Jones with the Senior Center Coalition of Indiana, and I am with this morning Dr. Christina Box, who is our Indiana State Commissioner of Health, and with Leslie Huckleberry, who is the Acting Director of Aging, and she's with the Family and Social Services Administration. We're going to be talking about what's coming up in winter and fall. And I want to kind of kick things off by saying, it seems like in public places, people are largely unmasked unless you're 65 or older. It seems that the people I've seen with masks on have gray hair and are being very conscientious about that. And I want to know, from the perspective of public health, is that where we should be at this point in Indiana, as though everything's over with?
So I think that is an excellent question. We know everything's not over with. We know we're headed into our fall season where we always see a rise in respiratory illnesses, whether that is influenza or respiratory syncytial virus, which in us adults is not usually as big a deal. It's a common cold, but for our children, or especially our newborns, can be a real problem, especially our premature newborns, or things like COVID. And although it's impossible to kind of predict exactly what's going to happen there, it really is something, I think, Deb, that we have to be cognizant of. And so we have to look at who are the people that are most likely to be adversely affected by things like influenza and COVID. And that has clearly been our elderly and our immunocompromised populations.
So far at this point, then, has Indiana seen any kind of quantifiable impact on physical and mental health, especially among older Hoosiers, that can be somehow related to isolation? Are we seeing anything like that?
Yeah, and Leslie may want to lean into this too, but what I will say is we definitely saw people throughout the pandemic delay their health care, whether that was going in for their routine annual with their doctor, following up with their colonoscopy or their mammogram or their pap smear that was due, or whether it was, immunizations for children. So across all age groups, what we unfortunately saw is more people arresting and dying at home. We saw more people coming into the emergency with much more acute medical problems, things like out of control diabetes, out of control high blood pressure, more heart attacks, things that had gone unchecked and unaddressed because people were hesitant to go into their healthcare professionals. Some because they were afraid of getting sick themselves by going in and seeing people in the waiting room, et cetera. And some because they didn't want to be a burden to the healthcare system at a time when we knew it was already burdened with a lot of COVID people. But most assuredly, and I'll let Leslie weigh in on this, mental health has been an important part of our physical health. And those individuals that have been the most secluded, the people that have been requested to protect themselves the most with our mitigation measures, like being in small groups only, not joining large groups, have missed holidays with families, have not been able to go to weddings and other big things throughout this, has been incredibly isolating for them and has contributed significantly to what is already sometimes a mental health issue for a lot of people as we age and we have lost friends and family and other people that are kind of our source of strength and our source of social interaction a lot of times. So that's been very difficult. Leslie, I don't know if there's anything you want to add along those lines.
Sure. Yes, I echo what Dr. Box said, that certainly there were lots of challenges presented, both in the early days of the pandemic and as it continued on, for a variety of reasons, I think, mostly tied to the social distancing and the hesitation that a lot of people felt in going out into those congregate settings. We have seen, certainly anecdotally, you hear about it, people struggling with loneliness and social isolation. But there has also been studies nationwide and here in Indiana, surveys that we've done that have shown that there's an increase in those experiences for folks. So that is a challenge and something that we've really worked hard to try and address as much as we could to provide support for those individuals.
Well, I remember.
Oh, yes, go ahead. Mm-hmm.
I was just going to say, I remember many very poignant moments throughout this pandemic, but one of them, my husband and I snuck out for the first time we'd been to a restaurant, and I think it was 2020. It was either that or 21 for our anniversary. I think it was 2020. No, it would have been 21, sorry, because we had been immunizing people. And I remember seeing a group of older, I'm not going to say elderly anymore because I'm right there with them on this, but but honestly, a group of older Hoosiers gathered at a table, about 8 of them. And when they walked in with their masks, when they greeted each other, they had their masks on, then sat down and took them off to eat. But they said, Merry Christmas, Happy New Year, Happy Easter, Happy Memorial Day, all those holidays and times when they normally would have gotten together and had missed, they were kind of celebrating together in August. So I just thought it was a really cool and poignant moment that they had been immunized. They now felt safe to go out together and to socialize.
Well, to that point then, as we look at fall and winter, and we are talking about centers that serve a population that's been described as vulnerable, 65 and older, even though many of our centers host people 50 and older, what should we be thinking about as we go into fall and winter? What are you hearing, number one, about new variants and surges? And number two, how do we stay safe from the isolation standpoint, the mental health standpoint, and from the physical health standpoint?
Really good questions. And again, with this pandemic, have hesitated to try to predict what's going to happen. But I would say we always see in the fall and the winter an increase, as I mentioned, respiratory diseases. So this is our time for influenza to go up, for respiratory syncytial virus to go up. We would expect that COVID would do the same thing. We come inside, we're not outdoors celebrating together as much. And so we do tend to spread it. So I think that number one is, most important thing you can do is get yourself immunized. And when we get our new boosters, which will be bivalent, which will include protection against the strains that we're seeing circulating most now, which is the BA4 and BA5, I encourage you to get that done, because that will be what really helps to protect you. I know that people are concerned because you can still, quote unquote, get the disease. You can still get an infection. But I will tell you, our data clearly shows that being immunized will decrease your risk for getting seriously ill, decrease your risk for being need to be admitted to the hospital, especially the ICU, and most importantly, decrease your risk for dying from this, just like with influenza. So I would say immunization, most important mitigation thing that you can do. And I would think the senior centers ought to really be a big part of in helping people to get that, encouraging them to get that, giving that evidence-based information, preventing misinformation from being spread. But I think also there are other mitigation things we can do. CDC very clearly shows what the community level of spread for COVID is. Mm-hmm. You can go on any day and you can look up your particular county and you can see what that level of spread is. And when that level is high, that may not be the best time, especially for our vulnerable population, especially for people. It's not just age-based. It may be people who are immunocompromised because they're getting treated for cancer, or they're being treated for rheumatoid arthritis with some of those medications that suppress their immune system. That is not the time to be going into groups like this and joining others. And so I think following that community level can be very helpful for people. I'm not sure if I'm ever going to get on an airplane again without wearing a mask. I think that honestly, I used to tease every time I went on an airplane, I ended up sick with a cold afterwards. So I may very well do that, especially in our fall and our winter seasons. And I'm, other than my age, a pretty healthy person. I think washing our hands, we cannot downplay that enough, because when we touch our eyes, nose, mouth with our hands, and we may have just shaken hands with someone or picked up something that they gave us, we may actually infect ourselves with that. So those are really important mitigation things. And then we cannot underscore enough, if you're sick, stay home. If you are exposed, watch carefully for signs and symptoms of COVID. And most importantly, test yourself. And if it tests negative, but you're like, yeah, I know I was just exposed to my brother-in-law and I know he had it and I'm not feeling good and I know it's negative today, but rather than go to the senior center, I'm going to go ahead and recheck tomorrow. That may be positive tomorrow. So test, let people know if you're positive so that they can be on the watch for that and they can protect other vulnerable populations, whether that's their new grand-born babies, their grandbabies that have just been born at home, maybe their daughter-in-law that's getting treatment for breast cancer, or their friends and family that are older like themselves.
Leslie, turning to the mental health aspect, then how do we weigh mitigation of isolation with the caution that we need to be taking?
And that can be a tough choice for a lot of folks, right? Because those feelings of social isolation and loneliness can be really, really critical and really difficult for people to deal with. And so I think that's something that folks need to think about for themselves. But there are lots of opportunities out there to continue to stay connected with folks, even while you are engaging in social distancing and being cautious, as Dr. Box described. So for senior centers, I would encourage connecting with your area agencies on aging and seeing what types of opportunities and programs are out there to help connect folks, even if they are remaining a little closer to home during this time. At the height of the pandemic, they engaged in a lot of different efforts like phone outreach programs, just to chat on the phone with folks and make sure they had that extra connection, using technology that's available to us today, like Zoom, to be able to connect with folks. I know some during the warmer months did things like parking lot bingo. Meal delivery was something that we really developed during the height of the pandemic as well, and something that continues today too. So there are those opportunities out there for people to explore if they want to stay connected, but also, really need to stay cautious as we see potential surges in the fall.
I know my mother-in-law is in a skilled nursing facility. My father was early on in this. Unfortunately, we lost him, not from COVID, but from other diseases. But bottom line is, anytime we go, we take our phones and we FaceTime. Oh, here's your grandbabies. And, she can't hold it herself very well because she's continuously swiping it closed or hear it extremely well, but she can see those grandbabies running around, and she can see her children. She can see, her great grandbabies. So it just is an exciting time for them. So I would say the more that we as senior centers can engage the families and the youth that are connected to these older people, to engage them in those processes, I think that would be helpful too, and help them to still feel connected.
Now, you made reference to the nature, kind of the regional nature of Indiana, and we have a patchwork quilt. I mean, some counties might be red when some counties are pale yellow. So what's going to be the best source for senior center leaders for guidance within their own areas?
So I think two resources. Number one, you can always look to your local health department, because they should have a pretty good handle on the outbreak in their area, how significant that is. And then truly, CDC has a really easy website, and we could send you the link to that if you actually wanted to put that in the chat or give that to all your senior centers. But you can go on and very easily pick your state and pick your county, and it'll tell you what your level is. I mean, and it's based on hospitalizations and numbers of cases, et cetera.
One question for the both of you as we wrap up, and the one-word answer, yes, no. Would you go out to a senior center and enjoy yourself come autumn and winter? Because we are finding senior center leaders who are saying that people have not come back, and some senior center leaders who are saying we're getting more people than ever because they now realize the costs of being alone. So
right.
We're trying to walk the fine line.
My answer to that is going to be yes, but please let me qualify that and say that I think you have to look at your own personal health. And if you are in really poor health, those are the people I need to be very careful. But to me, I take the approach to life. I'm going to do everything I can to protect myself, which means getting immunized, keeping up on the boosters that come out, wearing masks when it's appropriate, washing my hands, and then I'm going to go on and live my life. Because as I looked at my dad, his last 6 to 8 months of his life was without people visiting him. And it was a really difficult time. And I think if he'd been given the choice, he would have rather had the opportunity to risk the infection than to not have his continuous visits from his family.
And I'll echo what Dr. Bach said, yes, but with qualifiers that yes, but safely, right? So getting immunized, masking up, and monitoring the numbers in your area, and really just balancing that with how you feel personally, right? Because some people some people can be isolated but not feel lonely. And for others, that's really, you know, they really need that personal in-person connection. And so balancing that for yourself and figuring out what you need in order to have the best quality of life that you can. So doing it as safely as possible.
Okay, well, that was actually not the last, because I have one thing. Can you give one word of advice or a couple of words of advice to those people who are running centers? What should they be thinking?
So I'll go first this time. Yeah. So my word of advice would be to be asking folks how they are doing and how we can help them. Right. And so when they do have folks coming in, making sure they're asking them, you know, how are you doing? Are you feeling lonely? Is there anything that we can help you with, so that you know how folks are doing and what types of resources you can connect them to? I think sometimes it's easy to forget just to ask the question. And sometimes people just need to be asked, and they'll open up to you and let you know what they need.
And my one word is encourage them to get vaccinated. Be a source of information, evidence-based information, and how they can protect themselves.
Terrific. Thank you. Thank you both, Dr. Box, Leslie Huckleberry. It's been a pleasure. Thank you.
Thank you, Deb. We appreciate you.